See, at different stages of life, like when a child is born, you can get heart disease at that point also, because 1% of all live births will have some inborn heart disease. So if the child is not breathing well properly, too rapid, or is turning blue, or is not taking the feed properly, then these are early signs that there may be something wrong. So the child, even in the first few days of life, should be checked for any heart disease. Because now we have ways and means of doing it so that even the little baby can get their heart checked properly. Then, of course, if everything is well, and as the children are growing up, if they show signs of shortness of breath or palpitation like ghabrahat, then again they should be checked, because there are children who may be born with, say, what we call a defective valve, which does not show up early in life, but later in life, when they start getting very active, like 5 to 12 years of age, it may show up. So basically what we are saying is, if there is shortness of breath or palpitation kind of feeling, ghabrahat that a child gets, then they should be checked out. More importantly, when children get rheumatic fever in their childhood, then later on in life they may develop blockages in the valves of the heart, and that comes normally at the age of 20 and above. So 20, 25, 30, but main symptom is shortness of breath. Either they get tired too easily, or they get short of breath when doing some exercise like going up 2 flights of steps or things like that. Then comes the most dreaded of them all, is what we call coronary artery disease, heart attacks. And that can start anywhere from 30 onwards. Now, typical symptoms of coronary artery disease is what we call angina. Angina is the chest pain, pressure, burning, which may come repeatedly after doing an activity, whether if you are walking fast or running or trying to climb stairs, and then you stop, it goes away. This is what we call classical angina. But there are some atypical types of angina also. You can get it. It may go into the jaw, it may be going into the back. But anything that happens repeatedly on either exercise or when you get excited or get angry, should be ruled out as coming from the heart. So that's the one that happens in midlife. Then again, there are diabetics who may not feel chest pain, but their first symptom will be again shortness of breath. So any of these symptoms anywhere along the line in your life should be checked out for heart disease. Very much so. In fact, we know that if you have the history of, say, coronary artery disease, atherosclerosis in the family, then the children, especially male children, will have 4 times the chance of developing heart disease. So they have to be very careful. The genetics is a very important factor in development of coronary artery disease. For somebody who's just looking normal and suddenly collapses, and if it is from the heart, that is sudden cardiac arrest, what happens is that for various reasons, whether it is coming from an irregular heartbeat or it is coming from a blockage in the artery, the heart suddenly starts fibrillating. Instead of pumping like a pump, like which can pump blood into the body, it starts quivering so that no blood goes out of the heart. And if that happens, the brain stops and the person collapses. And unless you can get help to that person within the first 5 minutes of this happening, then they run the risk of a major brain damage. So sudden cardiac death is a very serious phenomenon. That's why we say, if population at large, means civic agencies like police, firemen, even students in school, even clubs like Lions Club, Rotary Club, as many people can learn how to give the basic life support, what we call cardiopulmonary resuscitation. It's a very simple thing to learn, but if somebody is in the vicinity of a person who collapses, you can save a life in your lifetime. However, if you do not get help within the first 10 minutes, then the chances of recovery of a patient from sudden cardiac death is